All right. Well, welcome everyone. I want to take this opportunity to welcome everyone who's joining us for this Intimate Partner Violence and RAP Centers in Ontario. This is the Resource Guide Utilization webinar, and so you're likely here because you are direct service provider, perhaps you're a manager coordinator of a center there. So welcome. My name is Carol Soros, and I am the project coordinator for this particular project, and I have been contracted as a consultant through Rexdale Women's Center. I have a background in working in the violence against women community, online program development, and a number of other things. So it's been my pleasure to be on this project. And then I have a co-facilitator today.
My name is Asra Milani, and I'm a research assistant at the Center for Research and Education on Violence Against Women and Children. And it is a great pleasure to co-facilitate this resource guide utilization webinar with my colleague. Yeah.
Thank you. So this project has been a collaborative initiative with partner agencies including Rexdale Women's Center, the Ontario Council of Agencies Serving Immigrants, OCASI, as well as the Centre for Research and Education on Violence Against Women and Children. And this project has been funded by IRCC Canada, Immigration, Refugees, and Citizenship Canada. So why don't we just talk a little bit about the purpose of this webinar. And so with this project itself, there are three primary deliverables or outcomes, including this webinar, that are coming out of this initiative. And one would be the resource guide. And so we thought after the resource guide was developed that it might be helpful for those who are using the guide to, to introduce them to the guide itself, because we know that it can be quite lengthy, and so this is an opportunity to highlight the rationale and importance of this issue, the opportunity to be introduced to the guide itself, and to outline the primary components that you will find within the guide. And just a little bit about the guidelines for this webinar itself. Go ahead and if you haven't already, download the guide. It is available in a PDF form along with, and it complements our training that we'll talk a little bit more about later. We'll also encourage you to download the utilization worksheet, which is accompanying this webinar. So if you don't have that, please go ahead and do that, and we will be going through that worksheet and how you can best use that in your practice. I want you to also consider how you'll apply this to your work. Of course, it's really important that you're not only here to take in this information and learn, but that you can then integrate it into the work that you're doing on a day-to-day basis. Of course, that's our goal. And then to take this a little bit further and discuss maybe existing or the need for new agency policies and guidelines. So you can expect that this webinar will be about 60 minutes or so, perhaps just slightly under, and we'll be reviewing the resource guide within this webinar. And it will provide an overview of the document itself, and it won't necessarily represent a training, so to speak. We do have an online training that complements the resource guide. It's very much aligned with the content of the resource guide, but this itself should not be considered to be a training. So why the need? Why the need for this initiative and, of course, this resource guide? So it has become apparent, given the arrival of more than 25,000 and growing government-assisted refugees in Canada, that a clear need has arisen to better understand and respond to incidents of violence that women refugees are experiencing. And just some statistics that we've highlighted in the resource guide itself, but just make it that much more relevant to why we're here and why this project came to be. So women experience serious violence 3 times more than men. Women are 5 times more likely to require medical attention and hospitalization. And women are 5 times more likely to fear for their lives. And these are all Statistics Canada quotes and statistics. And so these are some of the the statistics that we've highlighted in the guide, but there are so many more that support the existence and the impact of various forms of abuse and violence. And so at the beginning of this project, we started with a focus group survey. And we surveyed the 11 RAP centers in Ontario, and just to share a little bit about what the outcome and the data revealed. So nearly half of the respondents indicated that violence against women was identified or reported in the course of their work at least once per month. And we know that, unfortunately, that this is underreported and quite often unrecognized in many cases. So the majority of respondents reported that they do not have a specific process in place for responding to intimate partner violence. And perhaps not surprisingly, most of the respondents who did not feel adequately equipped to deal with witnessed or disclosed violence against women also did not have a specific process in place. And just in terms of the needs that were identified and came out of that focus group survey, here's some quotes from some of the respondents. So one respondent said, "We need more material around cultural differences and how to approach situations with a cultural lens." Another said, in terms of needs, resources and responding to men who have used abuse in their partner relationships. And many of these respondents also reported that vulnerabilities and special considerations of refugee women who've experienced women abuse, as well as the warning signs, recognizing them, are their top areas of training and support needs or interest. And so we were able to, use that information and make sure that it informed much of the work that we have been doing throughout this project. And throughout that survey, we also heard from many of you who are in the RAP centers who are providing the direct service about the unique needs and barriers. And within the resource guide, we talk about a little bit more, but here's what some of you said. While the incidence, obviously, of intimate partner violence in refugee communities is comparable to other communities, and we like to sort of make sure that that information is out there, but what is unique is obviously the predisposing factors and intersecting issues of violence, including these barriers that women face when attempting to address the issue. And so here's what some of the RAP workers reported, that government-assisted refugee women face problems such as a fear of being deported because they're not clear about their status in Canada, a lack of information about the rights of women in Canada, a lack of access to information regarding their legal rights and Canadian laws, a lack of access to social services and support networks, an experience of social and physical isolation, of course, language barriers, and then this fear of bringing shame to one's family. So you probably could identify that there's more, and we have gone into that a little bit more in the resource guide, but those were some of the main components, information, issues that were reported through our focus group survey. So just to go back a little bit and share more of the background of this project, how it came to be. And so this project began in August of 2016, will be completing in March 2017, and it came from a need identified and a discussion regarding one particular incident. It was an incident that happened at one of the settlement agencies where a woman apparently had experienced some form of abuse, and I believe it was physical. It was witnessed by a staff, and the response, I believe, was just not one that was the most effective and dealt with safety issues at that time. And so while that one incident, was something that stimulated and initiated this project, we know that it's simply something that raised awareness to an issue that has been ongoing and is something that you're reporting, and we know the women and families are experiencing as you're seeing them. So the lead contract manager for the project is the Rexdale Women's Center, and I started off by telling you who our partner agencies are. We also have an active advisory committee of about 11 members, I believe, 10 or 11, representing different resettlement assistance, women's organizations, different organizations that really are bringing their expertise and their experience to the table to address this and make sure that we are just providing the best possible tools for this sector. So our mission is to advance the current capacity of resettlement assistance programs in Ontario as they are responding to incidents of abuse within the context of their existing service delivery. And our hope for you through this project is to expand your existing knowledge base and to strengthen capacity on an individual, on an agency, and of course on a sector-wide basis. So we know that you as a service provider or a coordinator manager are offering a very valuable level of support at a critical and somewhat vulnerable time for families. And it's also a key contact stage for identifying crucial and potentially life-threatening concurrent or coexisting issues. And so our hope for you and for your agency and for the sector is to broaden the lens from which you see and serve these families. And of course, this is for the women, this is for the children, for families, for communities, and ultimately for our country. All right, so let's get into some of the resource guide components. And so what you will find within the guide itself is a list of some of the key relevant definitions for this issue and for the sector itself. You'll find theory, analysis, knowledge base that will support your understanding, your education, and of course you'll also find assessment and checklists which will allow you to just integrate a way to identify, to respond to, and to assess things such as safety, and we'll go into that a little bit more. And you'll also find resources. You'll find some primary resources. We'll encourage you to look at more unique resources to your specific community, but those are the main components of the resource guide that you will find. And so this guide, as well as the training, has been sort of developed around a framework of 3 guiding principles, and that includes recognize, so recognizing the existence at all, responding to anything that might be witnessed or disclosed, and then of course refer is the third. And so going into each one of those principles, the first one being recognize. So within the guide, you will find information regarding warning signs. And so those warning signs are really key to prevention and early intervention related to intimate partner violence. You will find also a high risk assessment in there. And so signs of high risk obviously are factors that have been found to escalate the level of threat or risk in any given situation. You'll also find primary, secondary, and victim-focused intimate partner violence risk factors, and you'll find those all within the subject matter of recognize. And then related to respond, and so respond is really looking at once it's kind of been identified or witnessed, then what are you doing about this? And I think that we've kind of framed it in a way of, what leads to a person's ability to increase their response or ability to respond in any given situation. And so talking a little bit in the resource guide about overcoming your apprehension. And so previously we discussed the barriers that the refugee women might be facing, but we also need to acknowledge that you might also be contributing to the service delivery process in ways that perhaps you had not even considered. For example, here are a few things that we want you to consider. First being, how comfortable are you with this issue? Second one is, do you have a personal history that contributes to challenges in responding to this issue? We know that, unfortunately, intimate partner violence, the violence against women, has touched the lives of many, and so maybe that's something that could impact your ability to, you know, to see and respond to these issues. Do you see families only from the lens of their settlement needs? And of course, that's the primary presenting issue. That's the really why they are coming to see you in a resettlement assistance program. But sometimes when we see things just from that lens, we miss an opportunity to really support that client and that family in a way that's most effective. Do you feel uncomfortable addressing the issue due to concerns about the partner's response? And we heard within the focus group surveys that some of the service providers are not comfortable. They don't know what to say. They don't know how to address it with the partner. And so perhaps that's something that you need to consider as well. Does your agency lack a clear policy or guidelines related to violence occurring in these families? And sometimes when there isn't a step-by-step, policy or a way of responding, then sometimes individuals may be reluctant to kind of go it on their own and respond in a way that they feel is effective when they're not necessarily supported by, a protocol that's in place. Do you believe in these situations a woman should leave? Or do you believe that she should stay? And I think that sometimes based on our own experiences, again, our own belief systems, that we may be coming in with some preconceived, not intentional biases or perspectives that could influence, your ability and you know, your 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 ability, your capacity to respond to these situations. So many of these are, they're not intentional blocks or barriers, but they are important for you to consider. And without that knowledge, you might be less likely to recognize or respond to these issues. So that's just to highlight what you might be bringing to any given situation. All right, so in the section related to responding, you'll also see the See It, Name It, Check It framework for conversations. You will find information about reporting, documenting, information, incidents, and details about anything that is witnessed or disclosed. And you'll also find information around safety planning. And then the section related to referring. And so we've talked quite a bit about working with community services. And so we've outlined a few primary ones like the Assaulted Women's Helpline, local shelters, and women's organizations. We talk about the legal system, so legal remedies and options for women. We included some information on talking to men, so strategies and services and potentially some challenges and also possibilities for responding in terms of and referring men in these situations. And then we talk about collaboration, and we really see collaboration and service delivery in a holistic sort of way. And so when we're collaborating, we're working in a way that reduces the risk, we improve outcomes, and the quality of service that's available to any person or family. And then we talk about developing organizational priorities, policies, and evaluations. And so outlining perhaps in your agency what are the goals related to intimate partner violence, what are the roles, what's the current knowledge base that's existing, and maybe knowledge gaps that might be also relevant. It's important to maybe have uniform practices so that you know that yourself and your colleague is responding to any incident of intimate partner violence in a similar way, although we do also talk about each individual being unique. Within your policies or your protocol, you might talk about supervision or consultation processes. You might talk about evaluation. So how are we doing as an agency related to intimate partner violence? And so these are some of the areas for you to consider related to referring within the resource guide itself. And so we were going to move on to the cultural context.
Okay, so cultural context. To make the content of this resource guide more culturally competent, we added a chapter specifically for understanding the cultural context. Although we know that intimate partner violence is a global issue and it affects people from all ages, races, ethnicities, different backgrounds, this chapter specifically explores how cultural background and significant life events such as forced migration would shape women's abuse experiences. We focused on migration and how pre-migration traumatizations of war and torture and post-migration stress of all types impact women's experiences, their access to services, and their options to leave or to mitigate the impact of abuse on themselves and their children. We also included immigrants' power and control will to represent immigration-related abusive behaviors that is happening in a migration context. There is also a discussion about cultural norms and rules in Canada and immigrants' cultural norms and rules. For example, a collectivist culture and individualist culture and how these kind of cultural orientation impact women's experiences. There is also a section on barriers, whether there are individual barriers or organizational barriers or more systemic barriers that women may experience, such as language or cultural barriers, system navigations, or their lack of understanding of the rights and the social services. Guiding principles. So you will find in section 4 the guiding principles in more details. Recognize, respond, and refer. You will find it in page 25. That there is a visual representations of the principles, which is a step-by-step action plan for a RAP worker to take in IPV situation in their organization. Having said that this process is not a linear process per se. For example, you can be in a referral stage with a woman and you may need to go back again and recognize some risk factors, some warning signs that you haven't identified earlier. So it involves lots of going back and forth throughout this process. Recognize means identifying early warning signs of abuse and as well as some risk factors. Respond refers to the model that you can have in order to provide support. We included a model that is called See It, Name It, Check It, designed for a conversation with the survivor, as well as an overview of a safety planning that you can utilize when you're working with the survivor. Refer, which is the third component of this principle, you will learn about the agencies that you can refer a woman or the agencies that you can use for your own knowledge for your consultation. Okay. There are also tools and assessments throughout the guide that I encourage you to print and use as a quick reference that you can use in any given situation. You learn about the guiding principles in page 25. There is also a full list of warning signs. You will find it in page 26. In a table, you see the signs to be abused or the signs to be abuser, but also you can observe and assess the relationship as an abusive or not. The signs of high risk, you will find it again in page 26. To assess a situation as high risk, that you should put a red flag on it, and it requires a quick action from you and from your own organization. And you may ask yourself a list of questions to assess a situation as high risk. Primary, secondary, and victim-focused risk factors in page 27 is a risk assessment tools that you can identify primary risk factors when the abuse has already occurred. For example, the abuser has already threatened the abused woman to kill her or to harm her or hurt her, or the issue has been escalating. It is getting worse and worse. Secondary refers to the situation that increased the risk. For example, You know that the partners are in custody battle, which we know that this increases the risks of IPV and the lethality of violence. Victim-focused are the factors related to the victim. For example, the victim is in a very vulnerable situation. She has no language whatsoever, or she's socially isolated, or she's living in a remote area which she doesn't have access to services, or she doesn't have, access to social network. See it, name it, check it framework as a framework that you can use to structure a conversation that you can have with a survivor. And you will find it in page 29. In page 32 to 34, you will find a safety planning. A safety planning depending on a victim's stage. If she's leaving the abuser, or while getting ready to leave the abuser, or after leaving. So I would highly encourage you to print out those tools and assessments, and so it could be much easier for you to utilize it in a day-to-day service delivery. Frequently asked questions. You will find it in page 40. We listed a number of common questions that you might have as an RAP worker. And that's kind of a quick reference for you when you witness or receive a disclosure of intimate partner violence as you're interacting or supporting a survivor. So you can have a look and see what those common questions could be. In page 42 to 44, you see a list of community agencies' contact information for making referrals or consultation when helping a woman. There are also several safety planning tools that has been included on those pages, and you can use it. Some of them are in a specific language. For example, as we're getting Syrian refugees, a high number of Syrian refugees, we included a safety planning in Arabic language. So a survivor can relate to the content of that safety planning, and it makes sense to them. To summarize, this resource guide is a comprehensive document, but it doesn't mean that it replaced the online training. We are in the process of developing our online training, which is an extension of this document, and it has an interactive, engaging components that you will find it exciting. This resource guide was developed to provide RAP centers with the information that they need to recognize and address the issue of intimate partner violence. It includes theory, it includes strategies, best practices, assessments, safety planning tools, as well as resources. In terms of what is next, I would encourage you to go through the document, the entire document once, and highlight the important points and print the quick reference and response tools that I mentioned. When you do that, you don't need to go through the entire resource guide if you need an immediate tool in a particular situation. You can just refer back to those checklists. Also, we develop a utilization checklist plan that you can complete it when you're learning about the material. If you have downloaded this checklist plan form, I will walk you through the different questions that has been included. The first question is, my main goal related to identifying and responding to intimate partner violence is, so think about your main goal. Your main goal could be getting a general understanding of the dynamic of intimate partner violence, could be your skills in assessing risks and warning signs. It could be anything. So think about your personal goal regarding IPV. My biggest challenge will be, so think about your biggest challenge when you're addressing IPV in your organization. It could be a lack of comfort to initiate a conversation with a survivor about abusive relationship. I will address these challenges by, so think about your techniques and strategies to address these challenges. So if lack of comfort comes from the fact that you don't know what is appropriate to say or what is inappropriate to do in this kind of situations, then find out those information and learn about the skills, the strategies that you can use to increase your comfort level when you're interacting with the survivor. How I will use this guide in my service delivery. So think about your 3 ways of effectively utilizing that document in your service delivery. It could be going through this document at least one time, or having a conversation with your colleagues about the content of this resource guide. Or it could be forwarding this document to other RAP workers who are interested in this subject and who are unaware of this document. How I will evaluate my effectiveness related to intimate partner violence. So think about your own evaluation, when you're at now and where you want to be within the next few months. So think about your personal evaluation about this issue. My agency guidelines. Think about your agency's protocol and policies about IPV, how your agency is tackling the issue, how you're addressing this issue in your own sector. Community resources referral list. So imagine that IPV is happening in your organization. Can you think of at least three community resources that you can refer the woman to those agencies or to gather information about IPV for further consultation? So think about 3 organizations that you can approach immediately when IPV is suspected in your organization. So this one-page checklist really gives you a framework on how to utilize this resource in your day-to-day service delivery, and I would highly encourage you to complete it in a convenient time and think about your own goal about that. Okay, so in terms of what is next, reading through the guide or taking a specific training is not something that happens one time. It needs a consistency to maintain our attention and awareness of the topic and see it as our priority to address that. Making yourself familiar with the resources available to you and you can refer to as it's needed and it's accessible to you immediately. Also, IPV can be a team or organizational discussion on how to address this issue in your organization. What do you have in place? What needs to be strengthened or expanded? What are some areas for improvement in your agency? And finally, share this resource with others. As I already mentioned that, spread the word, let other people know that there is something developed to address IPV, and have a conversation with your colleagues about that. What is next in terms of the project? We are developing a comprehensive online training that will be prepared in March 2017, and it's interactive. It has videos. It has a lot of engaging components that you will find it an enjoyable learning experience. So this online training will be an extension of this resource guide, and we will keep you informed when it is available and ready for you to go through this interactive online training. Okay. And finally, I just want to thank you very much for joining us today. Thank you for participating and making this as a priority. And I would encourage you to read through the guide once and support this project. We would really appreciate your support and taking this back to your organizations. Also, this document that we have developed is a live document, and we would appreciate any comments or feedback you might have for growth or for advancement of this guide. Thank you a lot for joining us today. I will leave you with my colleague Carol. She's here, and she will continue with you in terms of the follow-up.
Thank you very much, Azra. And yes, I just want to reiterate that. Thank you. Thank you for, you tuning in tells us that this is important to you, whether, it's something that was supported by a manager or a coordinator. It really takes your openness and your willingness to look at this as an issue and look at this as a priority for your agency and the work that you do, because as you are providing this valuable service for families and individuals as they settle or resettle in Ontario and Canada, that the support you are providing is so valuable. And so just adding this lens to see and address intimate partner violence is just going to enhance what the sector is able to provide to these families and to these women. So thank you again for joining us. And so in terms of ongoing contact, because this project is officially ending the end of March, the consistent contact, best contact would be to contact Rexdale Women's Center. And so feel free to reach out if you have those comments, questions, updates that for some reason you aren't receiving. You can also still reach out to myself as well, C. Soares, Soares, at rexdalewomen.org. So we want to thank you again. It's been a pleasure to have you with us and look forward to the ongoing continued great work that you're doing within the sector. Bye for now.